Hey guys, it's Dr. Jones from Revive Longevity Center. I'm at a conference out in Miami, and I've got my good friend here, Dr. Neil Kheterpal from Raleigh, North Carolina. Just a little introduction on this guy. Stud gastroenterologist. He owns like half the state up there. I think all the patients are lined up around the block to get in to see this guy. Like, Doc, will you do my colonoscopy, please? I mean,
you're giving me way too much credit.
You're not always the most popular, but when people need you, they need you, right?
That is true. That's true. Again, I appreciate the introduction. Yeah, I've been in Raleigh for a couple of years, practicing gastroenterologist. It's been a great journey, but I'm glad I got to meet you through these conferences. It's been great.
Yeah. So Neil and I met a couple of years ago, probably, and have got to become friends. And we've learned that we share a similar interest in being healthy, in being fit, and in talking to our patients about lifestyle choices and how important they are. So I thought it might be helpful if we just had a doc-to-doc conversation and just kind of chew on some of those things, the stuff that we're doing, stuff that we've tried that didn't work. Yeah. And hey, if there's any background noise, we apologize because we're just on a boardwalk out in Miami Beach, so it's kind of crazy.
It's been a great journey, obviously getting to know you, but I think a big part of it is we share the same passion for longevity and skincare, weight loss, hair loss. I think that's where we kind of really got to know each other and kind of collaborate more. So I mean, it's been great.
Yeah, no doubt. You know, when I'm talking to my patients, I'm telling them all the time, like, you've got to take good care of yourself.
Yeah.
You know, like lifestyle, it matters so much. And I'm curious what you tell your patients about diet. Like they'll say, Doc Jones, what do I need to eat? And I'll literally take a little Post-it note and I'll write fresh and I'll underline it. And then I'll write vegetables, fruits, lean meats. And I just hand it to them. I think they're wanting like a 5-page, thesis on all the best technical ways to eat. How do you handle it?
No, it's a really good point. I mean, a lot of patients do come in asking for just a recipe of things they can and cannot eat. And unfortunately, it is a little bit complicated. There's these general, recommendations that we do offer patients, avoiding, incorporating antioxidants, avoiding inflammatory foods like gluten, lactose products. So again, it all depends on what the patient is experiencing. We also know that the gut is really important because it plays a role in overall general health. Yeah. It also helps with mental clarity and just your overall performance from day to day. Having said that, what I've done with patients is I'll sit down, kind of assess where their symptoms are, see what they've tried, make sure they're up to date with any at least allopathic options or testing that we've done.
Okay.
And then we go from there and we explore with the help of dietitians, with maybe even, if there's a component of psychiatric components, just looking at other avenues or opportunities that we can provide as recommendations to tailor a diet that can work for them.
Okay, so it can be a little more nuanced than just eat your veggies.
It's not a one-size-fits-all, unfortunately.
Yeah, for sure. Yeah, that's good and special insight that you've got.
Yes.
I may need to tap into that a little bit.
Definitely a separate appointment. We'll get you in.
Yeah, there we go. So the other thing that we kind of have gotten into is you can tell by the silver in our hair that's starting to show that we've needed testosterone help lately. And so I'm taking a medicine called enclomiphene. I prescribe it for a lot of my patients. It made me feel initially just more energetic, and I think I felt just a better sense of general wellness. It wasn't like I was in the gym throwing around a whole lot more weight.
Yeah.
That did come for me, but it was like 2 or 3 months into the process.
Yeah. No, and again, that's how I connected with you too. I was noticing I'm well into my late 40s, and I was noticing with age and the silver, and I'm dying now, so it's not as much gray. But having said that, I was fatigued getting up in the morning. I was lethargic through the day. Felt like I had less energy. Mm-hmm. And that was it was unfortunately being experienced in a negative way with my family as well. With my emotions, my tolerance level for things was pretty low. Mm-hmm. And so when I reached out to you, I had read a little bit online, and you were kind enough to educate me. And not only educate me, run some tests, and then you sat down with me and explained to me how you could help. And now I've been on your program for about 3 months. It has changed my life. You've mitigated how you probably feel, but I thank you because I feel so much better. All those things that I was having issues with fatigue, lethargy, clarity, all that has improved significantly in 3 months. And now we're moving forward because I've gotten gained confidence in this whole platform, and now we're exploring other options. I appreciate you taking me under your wing.
Oh man, you've been great to work with. It's nice when you've got a model patient, who also happens to be a physician. And you're a friend too, so it's a lot of fun. Appreciate that. Yeah. So the next thing that we're both starting to get into, I think you just alluded to it, is peptides. And what are those bring to the table? In case you don't know, a peptide is just a scientific term for a short protein chain, and these have specific physiologic actions in the body. A lot of the hormones in our body need these peptides to tell the hormones what to do and how to function. And there are thousands and thousands of them, and some of them are starting to become available for human use. And that has been helpful. We're recognizing anecdotally. I think we're still probably a few years away from really having scientific studies to let us know clinically exactly how to use these. But in the meantime, there are a lot of fun to learn about, and I'm kind of excited about the future. What's your take?
I mean, I think peptides, so first of all, peptides have been on the market for a long time. We've known about peptides. It's been around for decades. In fact, the first peptide that we all know about is insulin. Having said that, I think the whole role of peptides is starting to become, I wouldn't say mainstream, but it's starting to become more recognized. And to your point, I think peptides are a link of amino acids that form little proteins. We have 300,000 peptides in our body.
Oh, is that all?
Of the 300,000, we only know about 80 of them. So that just tells you how far we still have yet to learn. But of the ones that are available on the market right now, I can tell you that there are plenty of people in Hollywood and these ultra super these athletes that are professional are already using them. They're bringing it up to the mainstream and showcasing and sharing with the rest of the world that they've already been doing it. In fact, if you go back to the 80s and 90s, Arnold Schwarzenegger, some of these big bodybuilders, they were leveraging peptides already at that time.
Were they really?
The thing is, you're right. Right now, the scientific data isn't there, but the anecdotal data is pretty robust. It's hard to ignore. It's going to be a matter of time before there's going to be enough funding that's going to help support the role of peptides in our community. But having said that, I think it is the next form of, it's going to be a branch of allopathic medicine, yet I agree, it's in its infancy.
It's kind of fun to be on this end of it with so much potential for, I'll be selfish, for personal use.
Yes.
And then to also help my patient clientele with it.
And I mean, exactly. So as much as, just like any physician, we want to make sure whatever products we're going to be endorsing are safe and are being prescribed in a safe manner. Right. Having said that, we are using it on each other right now to make sure that if we're going to prescribe it to a patient, for the right patient, they're going to have the same benefits.
That's right, yeah. Patient selection on all of these things is really important.
Absolutely. And education.
Because it's not a one-size-fits-all when it comes to peptides.
Like diet.
Exactly. Yeah. It's crazy how it all kind of follows the same thing.
Exactly. It's the art of medicine. And again, we have the scientific data, now we just got to figure out how to massage the artistic part.
Yeah, that's right. So when I tell some people that I like longevity medicine, some people don't get it. It's almost like they seem a little bit cynical. Like, who wants to live forever? Do you really want to lay in a nursing home bed for 20 years?
So again, I would probably change that comment to be, it's not longevity, but it's quality of life.
There you go.
So if we can extend a better quality of life, and quality is probably the operative word in that whole sentence, then I think people will be wanting to live that long.
Yeah.
So I think that's just where peptides are going to open up that box for us and give us opportunities where if you're 40 or 50, you can recapture a little bit of that fountain of youth and have a good quality of life.
Yeah, I agree. Have you read Peter Attia's book? Yeah. So there's a great book. If you haven't read it yet, I've done a separate series on it. It's a Peter Attia's book called Outlive, and he uses the term health span. And so we're not trying to live a long time. We're trying to enjoy a healthy life for as long as we can. I like to get into my hundreds, still able to be active, to go to the beach with my great grandkids, get on a bicycle and ride up and down the boardwalk. And I mean, that's the reason behind all of this.
And it all starts on the inside of your body. I mean, right now where we are today is, yes, we have options for plastics and aesthetics, which can make us look as good on the outside. Right. Where peptides jump in is now we're rewiring the inside body. And we're using the infrastructure we already have with the organs that we have. We're just increasing the hormones naturally that our body would be producing, but unfortunately with age it starts to deteriorate. We're just unlocking those mechanisms by stimulating, again, under the supervision and safety of physicians.
Yeah, that's good. Okay, we probably need to wrap up and get back to the conference, but we wouldn't be doing everybody justice if we didn't just harp on lifestyle. We talked a little bit about diet, but I mean, if you look at what makes you healthy, and healthy as a late 40 age male in America, is it because you take peptides? Is it because you take care of your health in other ways? How do you kind of summarize all
So
that?
it's got to be the marriage of the 2. There's no way that there's a quick fix. Like anything, even right now with our comorbidities that we have, where prescriptions are being offered, they're just a band-aid on the problem. Ultimately, it's the lifestyle that's going to be a long-term benefit. The same with these peptides, they'll help you get there.
Yeah.
But remember, these are temporary. You shouldn't be on peptides indefinitely. They're given in short doses and finite doses, and then there's a cycling to it. Having said that, the backbone structure to good health is going to be lifestyle, diet, exercise. And even when you come off these peptides, if you haven't changed your lifestyle, there's a likelihood you'll go back to the way things were. So again, I think maintaining that lifestyle is going to be the cornerstone.
Yeah. Dr. Attia said in his book that if he could write one prescription for all of his patients that they would follow, it would be exercise.
Totally.
Yeah, and
diet.
Yeah, and diet is right there with it. The other one that I would mention is sleep.
Yes.
Brian Johnson feels like sleep is the cornerstone of our health and ability to live a long, healthy life.
Yeah.
Sleep quality is important. The one that I've really picked up on the last few months and talked about it with the audience about a month ago in about a 5-part series is community. And just what a difference it makes whenever you've got family and friends and people who support you and get you, and that you can feed into and who can also feed into you.
Absolutely. No, I think you bring up a really good point. I think community is important. I also do see an alignment where we have a lot of wearable technology where we're able to analyze data.
Oh yeah.
Sleep obviously is one of them. Sleep hygiene is really important. We talk about it a lot. But with these wearable technologies coming out, I do see a partnership in the future where we can collect that data from wearables with these and peptides and lifestyle and see and actually map out milestones and see if there's not only improvement in how we feel, but are we actually hitting objective numbers. And I think sleep hygiene, I would not underrate. That's probably the most important thing that we overlook.
Yeah.
And technology, when we don't talk about wearables, but cell phones and TVs and Netflix, they're great. At the same time, we have to understand how to cut those off so we can maintain good sleep hygiene.
Yeah, that's right. It's all about a bit of balance.
Absolutely.
Yeah, and using things for our benefit and not let them start to eat and become a detriment to us.
Totally right.
Yeah. All right, let's get back to the conference.
It's good to see you, man.
Bro.
See you.